It's been a unique privilege for me to be president of ASH this year and appreciate the breadth of progress. We had over 6,000 abstracts submitted and we have major advances. There are 20 new FDA-approved treatments this year that occurred in the last year. Some of them are in hematology disorders, not cancer, but the majority are in cancer. We have on the plenary session and in the late-breaking abstracts paradigm-changing agents. So for example, we have a kinase inhibitor that will target the mutation in systemic mastocytosis, first in man clinical trial, well tolerated and very effective. We have many examples of combination therapies. So for example, venetoclax and ibrutinib in chronic lymphocytic leukemia is a wonderful new combination with increased extent and frequency of response. And then we have on the far end, we have actually on the plenary session a new therapy for Hodgkin's lymphoma. The traditional ABVD in a large randomized phase 3 was compared with the same regimen, except the bleomycin was removed and vedotin was added, and that resulted in an improvement in progression-free survival. That's being presented as well. So we have paradigm-changing treatments. Excitingly, we also have special sessions on CAR T cells. CAR T cells are FDA approved already in leukemia and lymphoma, but at this meeting we have many trials being presented that extend further the merit in leukemias and lymphomas. And also now this progress is extended to multiple myeloma. So we have, for example, in the lymphoma setting, trials that are multi-center, showing that in fact the CAR T-cell process can occur in multi-center clinical trials, showing very impressive responses even in far advanced disease. We have in multiple myeloma, in contrast to targeting CD19 in leukemia and lymphoma, we have BCMA as a target in myeloma. And there are several BCMA-related CAR T-cell experiences that look very positive. We also have much new information coming in the CAR T-cell area around how to best deal with the toxicity. We want to improve the efficacy by changing the vector, changing the co-stimulatory molecule, changing the kinds of T cells that we actually want to utilize, perhaps to a memory cell someday. On the other side, we want to be able to avoid the toxicity. So many strategies are being presented here in order to make this CAR T-cell concept more real and more widely applicable. So there's much progress in many areas here at ASH this year. It's really, I think it's a new record in terms of the novel agents that have been approved and that are now coming. Evidence of that further is there are 4 drugs being presented here that will be simultaneously published in the New England Journal of Medicine, and I'm sure that many of the others will be published subsequently in very high-ranking journals as well.